My today video is about food poisoning. What is food poisoning? How can germs get in food? What are the symptoms of food poisoning? Is there anything I can do on my own to feel better? Should I see a doctor or nurse? Do I need to have tests? How is food poisoning treated? Can food poisoning be prevented? These are certain questions which need explanation. What is food poisoning? So the food poisoning is an illness that can cause nausea, vomiting, or diarrhea. Food poisoning is caused by eating food that contains germs such as bacteria, virus, or parasites. One of the most common causes of the food poisoning is norovirus. Two examples of bacteria that are common cause of food poisoning are Salmonella and E. coli. Parasites include tiny worms that people can catch at different countries. How can germs get in food? Germs can get in food in different ways. People who are sick can spread their germs to the food they cook if they do not wash their hands before they touch the food. Germs can live in or on food if food is not washed or cooked enough. The germs in or on it can infect the people. Germs from one food can get in another food. This can happen when a person uses the same cutting board or knife to prepare different foods. What are the symptoms of food poisoning? Symptoms can happen right after a person eats the food or not until days or weeks later. Common symptoms of food poisoning include nausea or vomiting, belly pain, diarrhea that can be watery or bloody, fever. Other symptoms can include problems with the nervous system such as the blurry vision or feeling dizzy, but these problems are not as common. Is there anything can I do on my own to feel better? Yes, you can. Drink enough liquid so your body does not get dehydrated. Dehydration is when the body loses too much water. Eat small meals that do not have a lot of fat in them, and rest if you feel tired. Should I see a doctor or nurse? See your doctor or nurse if you have more than 6 runny bowel movements in 24 hours. You have blood in your vomit or bowel movements. You have a fever higher than 101.3 Fahrenheit that does not go away after a day. You have severe belly pain. You are 70 years of age or older and you have dehydration. The signs include lots of diarrhea that is very watery, feeling very tired, thirst, dry mouth or tongue, muscle cramps, dizziness, confusion, urine that is very yellow, and not needing to urinate for more than 5 hours. Young children and older adults with symptoms should see their doctor or nurse. That's because these groups can get dehydrated more easily. Do I need to have tests? Not usually, but it's possible that your doctor will do tests to check if you have dehydration or to figure out which germ caused your food poisoning. Your doctor might do blood test and a sample of your bowel movement. How is food poisoning treated? Many people do not need any treatment because their symptoms will get better on their own. But depending on your situation, your doctor might recommend fluids through IV line. IV line is a thin tube that goes into your vein. People with a lot of diarrhea or vomiting might need IV fluids to treat or prevent dehydration. Antibiotics. These medicines treat bacterial infection, but most people do not need antibiotics even if they have a bacterial infection. If you are very sick with fever and blood in your bowel movements, your doctor might prescribe antibiotics to help you get better faster. Some people find that anti-diarrhea medicine help. These include loperamide and bismuth subsalicylate, also known as brand name is Pepto-Bismol. Do not take loperamide or dipenoxylate atropine if you have a fever or blood in your bowel movements. Also, taking too much loperamide has led to serious heart problems in some people. If you have health problem or already take other medicine, talk to your doctor or nurse before trying loperamide. For all of these medicine, do not take more than the label tells you to. Children should not take anti-diarrhea medicines. Can food poisoning be prevented? You can reduce your chance of getting food poisoning or spreading germs that can cause food poisoning if you Wash your hands after changing diapers, going to the bathroom, blowing your nose, touching animals. Stay home from work or school when you are sick. Pay attention to food safety. Do not drink unpasteurized milk or foods made with it. Wash fruits and vegetables well before eating them. Keep the refrigerator colder than 40 Fahrenheit and the freezer below 0 Fahrenheit. Cook meat and seafood until well done. Cook eggs until the yolks is warm. Wash hands, knives and cutting boards after they touch raw food. For more safety and tips to prevent food poisoning, I will share some slides with you. If you're pregnant or have trouble fighting infections, talk to your doctor or nurse about other ways to prevent food poisoning. Thanks.